Welcome back to the Summit Independent Insurance Podcast, where we help you save money on insurance. I'm here with Tim Coughlin, founder of Summit Independent Insurance. We've been seeing more layoffs in the retail sector. I wanted to talk a little bit about this and what people can do. How are you doing today?
Good. We've been helping people with health insurance, Jack, here in Northern California. We are seeing more layoffs particularly in the retail sector, but we've been helping people determine whether they should go on Covered California. That's our healthcare exchange. California has their own healthcare exchange. Compare that option to Cobra, which a lot of people also have the ability to elect Cobra health insurance, comparing Cobra to Covered California and helping them decide what's best.
You get a call, somebody has been laid off, and they have this option. It can be confusing and expensive, especially Cobra can be expensive. Maybe you can go into how to evaluate that and qualifying life events people may have.
We recently helped a person referred by another client. She had been laid off and in a dirt bike accident or something and badly injured her legs
Wow.
and needs surgery. And she contacted us to determine whether she should go on Cobra or whether she should go on Covered California. It involved a lot of research. There was a husband and a son involved. We had to sort through the whole thing. Ultimately, it was better for her to stay on Cobra because she had already had two surgeries and met her out of pocket maximum. All her doctors were on the Cobra plan. It was tough to make sure all her doctors were on the Covered California. So, what we ended up doing in that situation was her staying on Cobra because she's got another surgery coming up and had already met her out of pocket maximum. We put the husband and son on Covered California, and they were still able to get premium assistance, which made their coverage much more affordable. I would encourage people to reach out to an experienced independent broker to get that kind of advice, because if she had just gone on Covered California, the premium would have been lower, but as soon as she had that second surgery or the other surgery that's coming up, she would have paid way more out of her pocket, and maybe her doctors wouldn't have been on the plan. It can be complex and depends on income. If your income is modest or moderate, then Covered California, because of the premium assistance, is much less expensive. It makes the premium practically zero. Now, the Cobra is more expensive, but again, if it's better covering your doctors, your medications, maybe you've met all or part of your out of pocket maximum, you need to make that comparison and make that determination. So you really need to make a good decision on that, and we can help people do that. There are other qualifying events besides loss of group coverage.
I read something about them getting rid of the income cap on premium assistance with Covered California.
Yeah,
That
yeah, that
true?
that that's right. They have done away with that. If people have high incomes or if they're single, or young, and have a good income, they're not going to get premium assistance. I've had people get premium assistance with incomes up to and above 250,000. For
Wow.
example, if they're yeah, it's really shocking. So, for example, if they're in their early 60s and they've got two or three, kind of college age kids, they can get premium assistance even with those type of high incomes. And then if it's like moderate income, sometimes they're getting like zero, or maybe they're paying $100 a month for health insurance. The amount of premium assistance they're getting is remarkable. So it's worth taking a look at Covered California. Besides premium assistance to reduce the amount of the premium that people are paying, They also can get cost sharing subsidies. And so if they get those cost sharing subsidies, it reduces the amount that they pay out of pocket and makes like a silver plan the equivalent of like a platinum plan, maybe even better, really. And so those kind of things can really be beneficial for people who need health insurance and, are wondering how they're going to pay for expensive health insurance.
Yeah, once you start getting into subsidies and everything, it becomes very important to be working with somebody that has experience in covered California, which obviously you do. I've been doing it since that program came into place. Uh,
Yeah. And it's
so,
gotten better. We can usually do an enrollment for somebody in, 15, 20 minutes on the phone.
oh, yeah.
And as I mentioned, people qualify for premium assistance and cost sharing subsidies. It can be a great program for people who need it.
It's worth checking. Depending on where you stand with your income and how many people are in your household, it can be a really great deal. But let's talk about qualifying events outside of losing your job that allow you to enroll in Covered California outside of that open enrollment period.
Yeah, there are events that make it possible to get health insurance outside of losing your employer coverage. If anybody has questions, they can reach out to us. You have to be within 60 days of that event to get the health insurance. It's important people take care of this, right away before they lose their opportunity. So if people are earning less than 150% of the federal poverty level, lost or will soon lose their health insurance, that could be there. We enrolled somebody yesterday, they lost their Medi-Cal eligibility. We're seeing that. We already talked about employer sponsored coverage. If your COBRA ends and your employer was paying for it, so you're like getting part of your severance as they pay for your COBRA, when the employer stops paying for that, that's actually a qualifying life event, so they can jump on to Cover California mid-year. You're
Okay.
no longer eligible for student health insurance. Turn 26 and you can't be on your parents' plan anymore. You turn 19 and are no longer eligible for a student only plan. There are some special enrollment periods created by emergency declarations, like for example, the fires in Los Angeles. You got
Yeah.
married, had a baby, adopted, got divorced, of course. You entered into a domestic partnership. You
Yeah.
moved into California. You gained citizenship or lawful presence. You returned from active duty military service, you've been released from prison and need health insurance. If you were forced to pay a penalty because you didn't have health insurance, that can be a qualifying event too. There are lots of ways people can qualify to get health insurance, and sometimes it's very affordable and good coverage with low out of pocket expenses.
You really don't know until you ask. It's worth checking if that's a better option than Cobra, any other option you
Yeah.
about private plan. But I think that it's definitely knowledge is power, and to have at least an idea of whether or not you can enroll and how much that would be, I think really makes a difference in your decision making. In my experience, Covered California is the more cost effective option. It makes sense for people to check on that.
Medi-Cal, if people have no or very low income, they can generally get on to Medi-Cal at any time. And that's an option as well. And if they do want to use an independent broker like ourselves, we're certified with Cover California. We're one of their what they call a help on agency. They feel free to give us a call. Again, there's no charge for our services.
Yeah, that sounds great, Tim. We'll put your information. Anything else before we go? I know you're short on time.
No, I think that's it. I was talking to a gentleman the other day, and he had become eligible for Medicare. And unfortunately, he's got cancer, but he stayed on his Covered California plan. And When eligible for Medicare, they take all the premium assistance away. I was concerned he's going to get a big bill next year when he files taxes and owe all that. He was getting about $1,000 a month of premium assistance, a huge amount, and he may end up owing all that money back. If you become eligible for Medicare, in most cases, you lose all your assistance and cost sharing subsidies. You have to move to Medicare in most cases.
Gotcha. Tim, wealth of knowledge, having you on. Thank you, and we'll talk again.